I'd like to yield and recognize the gentlewoman from North Carolina.
Thank you. Thank you, Congresswoman Burkle, for holding this special order tonight, along with my colleagues on the Doctors Caucus. And thank you, Mr. Speaker, for being here. You know, we are all here because we are health professionals. We know the real world of health care, and we know the real world solutions. It's the reason I'm here in Washington now. That and the fact that I'm concerned about where the future of the country is going for our children. Many times in our healthcare practice as a nurse and my husband's surgery practice as small business owners, over time we have always looked at these issues, whether we're talking about Medicare, whether we're talking about the possibility of having real good concrete tort reform, all of these different issues that we've said, if we could put these in place, healthcare could become a much more solid foundation moving forward. We already know that we have the best healthcare in the world, but knowing, being in the industry, having that small business, understanding where Medicare, Medicaid reimbursements were going, which are down, you have to ask yourself, how can this continue? How will we be able to provide healthcare into the future? Well, of course, we know that the health care bill was passed in the 111th Congress, and now we are seeing the effects of it. And one of the effects, as you have pointed out, are to our hospitals. You know, it's important that we are able to articulate this to the American people, connecting the dots. When we talk about the importance of why Obamacare is devastating to physicians, it's because it affects their ability to be reimbursed for their services. When Medicare will be cut, as we know in Obamacare, it was cut by $500 billion. Today, our seniors are saying to us, we're worried that you're going to cut our benefits. Well, their benefits will not be cut by any of us in Washington. However, because the dollars have been taken out in a significant amount, Medicare will have to say, I don't know what we'll cover. What are we going to cover? And as we know, again, in the President's health care bill, the 15-person panel has been put in place. This 15-person panel will decide what Medicare will and will not pay for. That will be direct payments to hospitals. Not just physicians, but hospitals based on the services that they're providing. And if they decide that a service cannot be paid for, there are penalties that can be assessed. There are solutions to this issue. And I pointed out, one would be significant tort reform, not only for our physicians, but again, for hospitals. Why is that important? Sometimes I'm afraid that we don't explain well enough to the American people why something like malpractice reform would help this situation. Well, we know that in our nation's hospitals, if you go into the emergency room, you're going to receive care, whether you can pay for it out of pocket or not, whether you have an insurance card or not, whether you're on Medicare or Medicaid, it doesn't matter. You're going to receive the care. The problem is someone does have to pay for those services because services are rendered. You go into the emergency room and many tests are ordered. Physicians order more tests because they are out of pure fear for missing something. You can't go into an emergency room and get the good care that you need to get if you cannot identify the problem. So, as we know, physicians at hospitals, physicians at doctors' offices tend to cover all their bases rather than simply relying on the medical education that they've received, the ability to diagnose with just that, with the ability of their practice. So here we are. We talk about healthcare costs every day and the escalating cost of it. A good contributor to that is another piece of the President's healthcare bill, which basically puts a tax on all medical devices. Well, think about the cost for any hospital, any provider. What do we do in hospitals? We do surgery. We provide for health care. These are medical devices. These are instruments that have made our lives better and help us to live longer, and yet now they will be taxed. This will be a tax that will have to be assessed. Someone, again, will have to pay for it. If the effort is truly to decrease the cost of health care, how can we continue by increasing the cost? It doesn't make sense. It doesn't add up. So again, the importance is, again, for us to connect the dots for the American people, to show that if we're able to pull back on Obamacare, that we're able to remove it, repeal it, as we have already voted on here in the House, then we can make the significant changes. There's one more point that I'd like to touch on, and there again, it has to do with the ability to pay for services. There was just a consulting firm, Mercer Consulting Company, just did a study which shows that 9% of employers with 500 or more workers say they are likely to cancel health benefits in 2014 after state-run health insurance exchanges begin offering coverage under the health care law. There again, once again, it will become the government paying for it, which is paid for by the American taxpayer dollars. We simply cannot continue on this path with health care or any other issue. It has to come with free market solutions, and we have those solutions, and we are ready to put those in place. And I just want to reassure our seniors who are receiving Medicare now or in the near in the future that we are doing everything we can to rescue Medicare from the President's health care bill and put those necessary pieces in place so that we can continue those services into the future that they have paid for their entire lives. Thank you again to my colleague from New York for holding this special order.
And I thank the gentlelady from North Carolina for